Hi everyone, my name is Isabel and I'll be presenting my poster on cognitive flexibility and mind wandering and the different profiles that we see in anxiety. So it's well established that populations with high levels of anxiety are more prone to repetitive negative thoughts and impairments in cognitive flexibility. Cognitive flexibility in this context is we're just talking about switching between mental processes depending on the changing environmental demands. However, little work has been done to investigate these relationships in off-task behaviors. So this is where our study comes in, where we aim to investigate how mind wandering differs in a population of high anxiety and to also determine the role that cognitive flexibility may play in these off-task thoughts. So in order to address these aims, we recruited 49 university students where they completed a few questionnaires. So that was the trait anxiety inventory, giving us an anxiety score. We also got cognitive flexibility scores. And then from the 4-factor scale of imagination, it was just the trait mind wandering characteristics. So that was emotional valence, how complex they were, how directed they were, and how frequently they were actually happening. The participant then went on to complete the sustained attention to response task, which is just a go, no go task. But throughout this task, we set up that there would be probes to ask them whether they were on task, intentionally mind wandering, or unintentionally mind wandering. So from this, we see that high levels of anxiety are associated with a higher frequency of mind wandering. They are also associated with more negative or higher frequency of negative emotional valence mind wanderings, and then a lower level of cognitive flexibility. Now, if you look at the probe data, we can see that between the low trait anxiety group and the high trait anxiety group, there's a difference on their on-task and off-task behaviors. And if we just break this off-task behaviors down a little bit further into intentionality, we see that there's no significant difference between groups in the intentional mind wandering, but we do see a big difference in the unintentional mind wandering category. So this means that more unintentional mind wandering occurs in this high trait anxiety group. What we also can see is that it's more negative and it's happening more frequently. This then is coupled with a lower level of cognitive flexibility, which could mean that they're not as good at switching back and dealing with the changing environmental demands, which then could really inform why we're seeing such a negative symptomology in some patients with anxiety. Now that's all the time I have. Please let me know if you have any questions, and thank you very much.